Powell. Here. Gingell is absent with notice. Commissioner Gershenson is remote. Erickson Galt.
Here.
Nelson.
Here.
Cavell.
Here.
Joliet.
Here.
Lubes.
Here.
We have a quorum.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes from November 7th, 2023. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? The minutes are approved. Our next item is approving the agenda. I have a motion by Commissioner Nelson, support from Commissioner Erickson Galt. All in favor say aye.
Aye.
Opposed? The agenda is approved. We arrive at our first public comment for items on the agenda. Is there anyone from the public wishing to comment on items on the agenda today? Seeing none, our first public comment is closed. We move to communications. There are 5 items under communications. From Health and Human Services, the 2022-23 program reports supported by American Rescue Act Plan, the local fiscal recovery funds, which include the Healthy Food Access Report, the Legal Aid Assistance Metrics Report, the School Mental Health Fund Initiative Report, and 1 item from Public Services, the Animal Shelter and Pet Adoption Center Report from October 2023. Any comments on communications? Commissioner Cavell?
I just want to bring attention to the legal aid report that they gave us, talking about households and individuals assisted with eviction and foreclosure matters. So you can see for yourself how there's at least 200 to 300, in some months 600 households helped with eviction prevention over the course of the last 20 months. And that this, then the total of households that were assisted with eviction or foreclosure prevention programming through the $2 million that this board gave them, these 3 organizations, was 8,367 households. And if we recall during CERA, there were 17,700 households getting their COVID emergency rental assistance for over a year. So just saying, we're going to continue to see this, and it's not going down, and it's kind of stabilizing at a plateau. So we should do something about that.
Thank you. Thank you for pointing that out. Any other comments? Commissioner Nelson?
Thank you, Madam Chair. Is there anyone here that could just provide a brief summary of 7A of the School Mental Health Fund Initiative Report?
A summary of?
Just, for some clarification, I know that if you pull up the document, it's just a 1-pager. I guess my question is, I see how much money we've spent within the administration fees, but how much money has actually been spent on assisting individuals?
Leanne, are you able to
I
answer?
can, probably between the 2 of us, because that's your OCH and Navigator report, so, good morning. So this is our partnership with OCHN, and so I want to say, and I think we have 5 navigators that are in the schools that are directly working with individuals in the schools and connecting them to behavioral health providers. Now, they may not ask for reimbursement. So what you might not see is that line item for the insurance being requested or reimbursement. But all 5 of those navigators are working with the kids in the schools every single day. Correct?
So, yeah, we do provide monthly reports. I don't have that data here with me, but we provide monthly reports that identify if a family requested assistance, where they were connected to assistance, and then also I think where the real trajectory is, where we see a significant change with having the navigators in the community, is that boots on the ground as well. So you have
I
the report.
know.
So our community outreach, they are, especially between April and October, they can be at anywhere between 30 and 40 events a month, giving and distributing information and making people aware of the reimbursement. A lot of what we see then too is a follow-up for that continuum of care with families, because sometimes families aren't ready to be connected to support, or additionally, families are concerned and don't want the reimbursement, so we keep, that's an education piece for us. So last year, we had 126 presentations for May, community service requests 315, service requests that were fulfilled 246. So that may be Medicaid eligibility or other things, and if people aren't eligible for Medicaid, then our teams work with them to navigate their own private health insurance. And then requests that were not fulfilled were 69, and those include families that were referred to OCHN by the school, and we reached out to them, but the families did not reach out to us. So again, that where we see the biggest change with this is the ability to reach the community, and then where we also connect some of those dots that we don't necessarily report here. You can see a direct relationship to the number of people visiting our websites, the number of calls to access, and then the number of calls to the crisis number. And then that includes also the youth and family care connection that was opened earlier this year.
Sure, so just, thank you. Just so I'm understanding, under the columns of the total funds used, so just so I'm understanding, so it looks like $456,602 was the total funds received, and out of the $456,000, $435,000 was spent on administering it?
So that's on administration, so that's 4 navigators, 1 referral specialist, and then 20,000 for insurance claims, for the actual insurance reimbursement.
That's for the individuals working in the community.
Yeah.
Sure. But did I read that correctly? Of it cost $435,000 to administer out of $456,000?
So
Yeah, that's what's been used,
that's
and then
what's been used,
20%.
and then the 20% there. So then I'm looking for the October 1 through September 30s, 379, and then admin was 350.
So it's $435,976,000 to administer the program?
Correct.
Correct, so you have 4 full-time school navigators servicing the entire community. That would include benefits packages because they are full-time, and then we have 1 referral specialist and then a part-time admin who helps coordinate everywhere they go.
So only $20,000 went towards offsetting the cost?
20,000 went for insurance reimbursement for people who requested it. Everyone has offered it, but we're seeing different than what we saw a little bit in Oxford, but not too much. Everyone that they come in contact with is given the information about the insurance reimbursement piece itself, but that's the only amount that was submitted for reimbursement. So a lot of people with private insurance, I don't know if they have other relationships within their organization that may help with the copay, but we did not see a significant request for insurance reimbursement in the same way we did when we saw the initial Oxford crisis.
I see. Thank you. Thank you, Madam Chair.
Thank you. So that amount is for salaries and benefits, it's for the people, so
Yeah.
employees. Okay.
We can get you more information about where they're going, how they're connecting, and then what those outcomes look like.
That would be helpful.
They are keeping very close track of that.
Any other questions regarding communications? Oh, we have a motion. What was Commissioner Nelson made the motion and Commissioner Erickson Galt seconded. Okay. So all in favor say aye. Aye. Opposed? All right, communications is carried. Our next item is from the prosecutor's office regarding positions, deletions, creations, and we have a representative here to speak to that, but I need a motion first. I have a motion by Commissioner Cavell, support from Commissioner Powell, and David Williams is here via virtual to talk to us.
Morning. It's good to see everyone. I appreciate the chance to address the committee Obviously, it's always nice to be here on a motion that saves the county money. Obviously, that's great. But just briefly, I want to explain to you why this is really important and helpful to us. So we have very experienced, talented attorneys here who practiced here in the office or practiced in as prosecutors over decades, and they get to a position where they can retire, and we hate to lose their experience. And what we found is if we give people flexibility and let them retire but then come back part-time without benefits, we can retain them. And we have a couple of cases where we've successfully done that, and it really helps us because we're keeping top-notch people at a relative bargain. The other issue we have is right now, it's hard to recruit. We've been pretty successful in getting good candidates to apply. We have filled almost all of our positions. But what we really have here is a situation where it helps us keep people, it helps us keep talented people, and it saves the county money. So it's from our perspective, it's a win-win-win. I'm happy to take any questions.
Thank you. For the people who retire and return part-time, is there a time frame they're able to return part-time? Do you have like 6 months before they're able to return? Is there some kind of rule about that?
I don't think so. Not for people who, these folks did not get a buyout. One came from another agency and 2 of them were full-time employers here who simply retired. But because they weren't part of any buyout, I don't believe HR made them go through a waiting period.
Okay, thank you. Any other questions? Commissioner Erickson Galt.
Thank you, Chair. So if I understand correctly, you're not eliminating an existing employee. You're eliminating what would otherwise be an open position and replacing with part-time positions.
That's exactly right. So what we've got is we've got some people right now who, in order not to lose them, we have them filling full-time positions as part-time employees. And this allows us to pay them and have them fill part-time spots. So we're not losing a half a person.
Thank you.
Any other questions? All right, drop the vote, please.
We have 5 yeas, 0 nays.
The motion carries. Thank you. Thanks for being with us.
Thank you, everyone.
All right, next 2 items are from the Sheriff's Office. The first is increasing marine safety patrols on Oakland County lakes for 24 and 25 boating season. And the second item is the transfer of ownership and release of claims agreements for Canine Dog Rebel. I have a motion by Commissioner Nelson, support from Commissioner Joliet, and we have our Undersheriff and Diane Spear here to talk about these items.
Good morning. So the first item, I'll just give a little history because obviously we have a new commissioner that has not, so welcome. We haven't met yet. 2 years ago, I think it was, Commissioner Nelson, the board had set aside about $150,000 for additional lake patrols, marine patrols. The first year, we were appropriated $50,000 and it was a really big success. I think everybody that experienced the additional patrols was happy with the results. We provided a report to the Board of Commissioners. Last year, we were able to get some MEDC funding for additional patrols, so we did not need to request this money. Now we're coming forward for the remaining $100,000 to appropriate it, split 50-50 in years 2024 and 2025 for the boating season. The first time we did it, it was closer to May, and then we didn't really have time to hire additional deputies and train them and have them go through the Marine Academy. So we're coming to you now to get a head start so they can hit the ground running in January and be ready to go for Memorial Day weekend. So I'm happy to answer any questions. You want me to do the second one?
Are there any questions regarding this item? Commissioner Nelson?
Thank you, Madam Chair. Just quickly again, I appreciate the work that our Marine Patrol does here in Oakland County. As we all know, we have the most inland lakes than any other county in Michigan, and it's really important that we maintain safety. So I appreciate and thank you for the work that our Marine unit has done. My only question is there any changes to any of the criteria that was initially put in with the last 2 $50,000?
I don't believe so. I think we
I
had
didn't
kind of
see
worked,
any,
yeah,
but-
I think we had, so we were just, it says pilot program, but it was really a continuation of what the criteria that we had set up. And then obviously, I don't think I mentioned it, but I think it says in there that we'll provide a report. After each voting season, we'll provide a report like we did 2 years ago.
Excellent, thank you.
Commissioner Joliet?
Hi, quick question, not necessarily pertaining to this program, but pertaining to the Marine Division. So obviously, what are there, 30, well, I know there's 34 lakes in Waterford, so around Oakland County. So obviously not every lake has or qualifies for this because there's a lot of private lakes. But in the event of an emergency, in the middle of the night, can they call the sheriff's office and is there a Marine patrol to go out if there's a problem on a lake?
Absolutely.
Okay,
Yeah,
respond.
absolutely.
okay.
To all calls, yes. And then we have our search and rescue team, which is really kind of beefed up that response
okay.
and rescue.
Great, okay, thank you.
Before this program began, I saw videos of activities on the lakes that were quite exuberant. And I am glad that our Marine Safety Patrol is there and has made a difference so that it's safer and family friendly. And it was a marvelous program for Commissioner Nelson to introduce.
Yes, we definitely appreciate it.
Yeah, I'm happy to continue that. Thank you.
Exuberance is a nice way to put it.
Commissioner Nelson's shaking her head, like, I don't know.
Said it well, Madam Chair.
Yes, okay. Well, tell us about Rebel.
Okay, Canine Rebel is a 10-year-old Dutch Shepherd who has reached the end of his career. He was trained in explosives and he will be retiring in early January, so we're just asking for your approval.
Thank you. You are so concise and complete. My question was, how old is a retirement age for a dog? But you mentioned that in your first sentence. So
Usually it's 8 or 9, so 10's a really, especially for a shepherd, that's a really long career. So he's at the end of it. We've gotten our money's worth out of Rebel, so.
Yeah, thank you. Any other questions? All right, will you prompt the vote?
You have 5 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Thanks for waiting for us.
Can I just give you a quick update on the, at the jail?
Oh,
So last Wednesday, I attended the first graduation of the Into Work program through Aramark Food Service. So if you recall, we actually started it before the pandemic. We had one class and then the pandemic shut everything down. But so we had 3 people graduate with their Serve Safe certificates. All 3 of them are getting released within the next couple of weeks, and so it was just a really nice, it wasn't a big ceremony, but we wanted to update the board in case anybody was interested in future ones. Obviously, that was the inaugural program. Major Perry and Captain Vita both gave really kind of inspirational speeches to the folks and said, this is your chance to make a difference. Life is all about overcoming adversity, and now you have this certificate that you can go out in the world and you can make a difference and you have a second chance. So it was really, really nice. I just wanted to share that with everyone.
I like it. We change the world one person at a time. That's how we make a difference. Thank you.
Thank you.
Thank you.
All right, our next 7 items are from Health and Human Services recommendation. The first is acceptance from the Michigan Fitness Foundation for the fiscal year 2024 Supplemental Nutrition Assistance Program Education Plan. The second is the subrecipient agreement with Oakland Livingston Human Services Agency for 2024 Women, Infants, and Children's Services. The third is acceptance from the Michigan Public Health Institute for the 2024 Health Equity Regional Council Backbone Grant. The next is the Neighborhood Housing Development acceptance from the U.S. Department of Housing and Urban Development for the program year 2023 Annual Action Drive. The next item is a presentation regarding your Housing Trust Fund, and the next few items also reference the Housing Trust Fund, the Wellspring Project for Affordable and Permanent Supportive Housing Development in the City of Southfield, and the Housing Trust Fund for Royal Oak Cottages Project for Affordable Housing Development in the Charter Township of Royal Oak. Who would like to make a motion? I have a motion by Commissioner Powell, support from Commissioner Erickson Gold. So welcome. So we have our whole team here.
Yes, we do, yes.
Talk about this. So the first few are acceptances for grant programs. Do you want to talk about the SNAP program
Yeah, I
first?
can just give a few updates, and if there's questions, I can take those first. So the SNAP Ed program, we have actually been delivering since 2011. It's a continuation program. It's with Michigan Fitness Foundation. It's actually a subrecipient from MDHHS. And in this program, it is specific to Pontiac. We offer nutritional support and even demonstrations on how to prepare food. So when they go to grocery stores, right, and maybe there's a fruit or a vegetable that's sitting there, really thinking of ways that they can incorporate it into their daily lives. So this grant, it allows us to have one part-time health educator that focuses all their time in Pontiac for this. They actually go into the schools as well and talk about, nutrition, healthy eating, as well as active living. And so it's gone very well, right? So we're happy that Michigan Fitness Foundation selected us again to house this grant and be able to offer these services. So
Thank you.
and it's about $40,000 it is for a part-time person. So the next one is, I think, OLSA, which is Oakland Livingston Human Services Agency. So WIC obviously is a very important program here in Oakland County. Oakland County can't do it by ourselves, so we actually partner with OLSA to deliver services in 5 other locations in Oakland County. So they provide in Farmington, they also are in Oxford, in Holly, Madison Heights, and then downtown Pontiac in their building there. So we have a subrecipient with them where they provide services there for their caseload, as well as breastfeeding support for those in WIC. So it's been a partnership for a very long time, and this will be we're accepting this through September of 2024. And then the last one is a continuation grant. I'm really excited about this. The Regional Health Equity Council subrecipient grant, they're looking to provide $300,000. This is really looking at reducing COVID disparities, what we saw as part of COVID. And so we're working with some very small partnerships to really try to make an impact. So if and when the next big pandemic hits, then we're prepared to really focus on some of the disparities and how we can really look at that moving forward. So we're going to offer some mini grants. Some of these very small partnerships, it's difficult for them, right, to spend extra time on extra activities. So we're looking to partner with Pontiac Community Foundation to provide some mini grants to about 8 organizations.
Thank you. Any questions or comments on these 3 items to date? Okay, then we'll move on to we have the neighborhood and housing development acceptance and a presentation. Do you want to do the presentation first?
What about we do the grant acceptance, because then the other ones go together with the Housing Trust Fund.
Thank you.
Yes.
Thank you, Madam Chair. So yes, we would like to request from the committee acceptance of our 2023 program year grant funds from the Department of Housing and Urban Development in the amount of $8,284,774. This supports our community development block grant programs, our home improvement and revolving loan programs. It also supports our emergency services grant and the 24 positions that fall within neighborhood and housing development. We're very pleased to once again be able to provide services for these programs that are so needed, working of course in partnership with HUD. And looking at continuing to promote and push forward housing initiatives and ways to support our communities through our CDBG Community Development Block Grant dollars. And so we would like to request acceptance of dollars, which is an easy request to make. And we like to make those types of requests. Thank you.
Thank you. It's a well-run program that many people take advantage of for home repairs.
Yes. Yes.
Okay, no questions on that. Do you want to move on to the presentation?
Yeah.
This is the presentation.
Did you want to kick it off?
Yeah, just 2 seconds. That we want to thank our commissioners for support of the Housing Trust Fund. both Kyle and I have been extremely busy since starting our term here at the county about 6 months ago. And I am so pleased with the progress that Kyle and team and all of us have been able to make with some really amazing projects coming down the pike because of the Housing Trust Fund. And so we're pleased to bring these 2 projects before the committee today. And I'm going to hand it over to Kyle to do the presentation.
Let's see how we're doing up there.
Pulling it up.
Just so everybody knows background, I'm Kyle Hines, the Housing Trust Fund Manager. So thank you for your time today. We're very excited about these 2 projects we have under consideration. There we go. So just want to give everybody a refresher. It's been a while since I've talked to everybody about the Housing Trust Fund and when it was first approved, but it was initially funded with $10 million of ARPA, state, local fiscal recovery funds, and $2 million of general funds. The Housing Trust Fund is authorized to make investments up to $1.5 million. Anything over $1.5 million requires full Board of Commissioners approval, and that's why these 2 items are in front of the board or the committee for consideration today, because they are both over the $1.5 million threshold. However, the board reviewed and staff reviewed and confirmed the financial gap that is necessary for the board to fill. So we're very confident and are very supportive of the projects and making this investment. Our first meeting, just to give kind of an update on where we've been, our first meeting occurred in September 2023. We adopted the corporation bylaws, or the fund bylaws, and approved our notice of funding availability and application, released that. And since then, we've received about 8 complete applications totaling 452 units. 264 of them would be affordable, income restricted. And if they were all to be approved, that would equate to about $145 million investment into mixed income housing throughout the county. Obviously, not all of them are ready for complete approval by the board. The applications need to be reviewed. We're missing some items on about half of the applications. However, we're working with the applicants to get them up and ready to go, to make sure that, one, the project should move forward, that it makes sense for the county, that the sponsors have all of their team buttoned up, and that they're financially feasible. So that's kind of where we're at with the ones that haven't been approved yet. But we have 4 applications reviewed, scored, and recommended by Housing Trust Fund staff and the board. All 4 of those have been approved. 2 of them were below the $1.5 million threshold, so those are moving forward. That's just for background, those are for sale development communities that will be targeted as neuro-inclusive housing developments. So about half of the units in those developments will be for sale for intellectually and developmentally disabled residents. So they have they actually be able to build equity and have permanence in their housing options for their houses. And like I said, that's in Rochester, and that has received board approval at our November meeting. At our October 18th meeting, which the 2 projects that are in front of us today are the Wellspring project in Southfield and the Royal Oak Cottages, which are in Royal Oak Township. And I'll tell you about those in the next slides.
There's the clicker down there.
Oh.
There we go. Okay, so the Wellspring project, this is a 72 unit affordable and permanent supportive housing development. The applicant and sponsor is Southwest Housing Solutions. They've done projects all throughout Southeast Michigan and are a very responsible development and have a great team put together. 60 of the units will be permanent supportive housing, and this will be targeted towards residents that are in recovery, substance abuse recovery, particularly opioid addiction. Those residents will be referred to the project by drug courts throughout the county. Permanent supportive housing, for those of you that don't know, is affordable housing that includes wraparound services to assist residents that have disabilities and or other factors that lead to housing instability. In this case, substance abuse, and we're going to provide wraparound services to be able to support them. And then it also has 12 non-permanent supportive townhome units that will be at the front edge of the property that'll serve just regular residents not needing permanent supportive housing services that are earning at or below 60% of the area median income. And at the end of this presentation, I'll show a slide at what that income level is and what those rents are and who we're actually serving. So all told, this development will be about almost $34 million of total development costs. The Housing Trust Fund Board recommends a $2.6 million in gap funding for Board of Commissioner approval. The $2.6 million funds will be allocated to the project in the form of a subordinate repayable loan. So over the life of the project and at any point that the project would be sold, the Housing Trust Fund would recoup those funds at that time. And we're not the only ones providing, funding support for this. Obviously, it's a $34 million project. There's a lot of partners. So MSHDA is also providing gap financing dollars as well as the tax credit for the project. The city of Southfield is approving a pilot for the project and providing funds. And then they'll also be raising private debt and tax credit equity to round out the capital stack for this development. If you want, I actually have that. So I don't know if you can see that, but I wanted to show a map showing where this is. It's gotten great reviews and support and approval from the city of Southfield. Mayor actually showed up to our board meeting to provide support of the project. So whenever you have the local community support like that, it makes our lives and jobs much easier at the Housing Trust Fund Board. And then there's kind of a rendering of what the project looks like. This is actually a recreation of a wildly successful project called Andy's Place in Jackson, Michigan, that we actually toured, that's providing the same exact services that we'll be providing here. So this isn't the first, the first iteration of this type of project. So it's been very successful, and we've had a lot of support here to be able to bring this type of programming and services to Oakland County. So we're excited to support that. It'll look a lot like that. We'll answer questions at the end. Okay, next project is the Royal Oak Cottages. This is a 32-unit affordable single-family rental development in Royal Oak Township. And it's also being presented and proposed by Southwest Housing Solutions. 32 units, these 32 units will be on scattered sites, which means it's not a contiguous plot of land. It's on various vacant sites throughout Royal Oak Township. And these will be reserved for residents earning 30% of the area median income. And those will be 16 voucher units, which we desperately need throughout the county. 40% AMI, 50% AMI, and 60% AMI. All of these homes will be 3-bedroom and 2-bathroom homes. Royal Oak Township is actually contributing the vacant lots to the development, so we're excited about that participation. And then the activation of these long vacant lots will serve as economic development catalyst and actually stabilize these neighborhoods, raising property values while still maintaining affordability and ensuring people won't be displaced from their communities. And it actually, when we talked with the supervisor and the township manager, a lot of the talk was, people want to be able to move back to Royal Oak Township, but there just wasn't any new housing stock. This will actually be able to provide that. So we're super excited about that. All told, this 32-unit scattered site development is about a $15 million development cost. The Housing Trust Fund Board recommended $2.5 million in gap funding at our October 18th board meeting, obviously requiring full Board of Commissioners approval. The 2.5, same as the other project, the SLRF funds will be allocated as a subordinate repayable loan. MSHDA, Royal Oak Township, and private debt tax credit equity will also be providing funding to round out the total project cost for this project. I will say it's great to be able to present to you kind of both sides of the housing equation today, where this project serves as almost an economic development catalyst type project, whereas the Wellspring project kind of helps us with the health and health aspects of housing. So providing that stability for people to work their way through their recovery. Two different types of projects, but doing both great things for the county. So As you can see, it's right here in Royal Oak Township. Those are a rendering. They're not all gonna be the same color. There's different styles and facades they have, but I just put one up there for here today, but they will make sure that it intertwines and looks good and meets the character of the neighborhood. They had to work with Royal Oak Township to get a pilot for this project as well, so they've all reviewed it and looked at it, so very excited to be working with them. So the next slide, I'll show you, here's the incomes that we're talking about. We don't have any 80% units, 80% area median income units in this project, but there will be other housing trust fund developments that will have those in the future. But this just kind of shows we're from a single person at 30% AMI is about $20,000 to a family of four is $56,000 for 60% AMI. These are our HUD limits for 2023, and that's what we base our limits on for the Housing Trust Fund. The rental rates themselves depend on whether the unit size and your family size, but all of it's targeted and designed to not go over 30% of your family's income. And then voucher units can actually target even lower people without even any income as well. So when you look at this, this is kind of my soapbox here is when you're out there and you're talking to zoning committees and they're like, we don't want those people living here or when the NIBB playbook gets called out. This is the incomes from the Bureau of Labor Statistics for Oakland County. These are the people we serve with our affordable housing, and we should serve them by providing them with safe, decent, affordable housing near their jobs, near employment centers in Oakland County. I mean, you have security guards, waitresses, preschool teachers, nursing assistants, paramedics. These are all the people that make Oakland County work, and we need to be able to provide affordable housing for them that they can live and have safe, decent, quality, affordable housing throughout the county. So I always love showing these slides, because AMI percentages, rental rates, that doesn't really mean much when you know that the people that are actually educating our kid, healing our kids, and providing security for our families, that's who we need to be supporting, and that's what these projects will be doing. And we're working on plenty more, and tomorrow we'll also be requesting more funds, and we're hoping to get them to be able to do even greater work. So with that, we will open this up to any questions you may have.
What's a recreational protective worker?
I don't know, it was on there, and I know that we have a lot of parks. I don't know.
Park ranger.
Park ranger? Okay.
So does
Thank you. So, and in Royal Oak, the Royal Oak cottages, they're 3-bedroom,
3-bedroom, 2-bath.
2 baths. Do you know how many square feet the housing is?
They're between 13 to 1,600 square feet.
Nice, bigger than my house.
A lot of it depends on the lot sizes, because it's, old vacant lots,
When they're scattered around Royal Oak Township, is it in the same multi-block area or scattered around the township itself?
where does do we have the streets?
It's really
It's pretty
like,
hard to scatter among Royal Township. It's kind of two small areas.
Yeah, they just had little areas of where
the
Yeah, there
blocks
was-
are next to each
lots
other.
of different areas.
The blocks
One
are
or two
next-
blocks
yeah.
together.
It's like, it's kind of the eastern side, it's closer to Ferndale than Oak Park, and they all pulled I think Ferndale schools.
They are Ferndale schools.
Yes.
Yeah, and then some of the sites weren't used because they were right next to old manufacturing facilities, so you can't really put tax credit, environmental justice, equity issues there, so they're all kind of targeted right in the neighborhood. I think I have the road somewhere here.
But the streets are close,
Yeah, it's
the blocks are together.
They'll be partnering and partnering with various community services providers that will come to the homes and provide resident services on an on-call basis as needed. So it's not just, here's your home, live in it. We're also providing supportive services that you would see in a regular multifamily development targeted towards, the resident services that the residents would need there. It's not recovery, substance abuse recovery programming, but this could be job training, this could be after-school programming, this could be healthcare services. So they'll be providing those things, and that'll generally be standard for any sort of tax credit development that you see from us.
You pretty much thought of everything, providing life skills for people who move in there. I'm really quite proud to be part of Oakland County right now, so thank you.
Love to hear that.
Yes. Commissioner Powell.
Okay, so with the Wellspring 72 units, what's the sizes on their square footage and what are those? 1, 2 bed, like what are those? What's the?
So the Wellspring has 1, 2, and 3 bedroom.
And square footage?
Square footage, it'll be at least the minimum that's required by the state tax credit program, which I think a 1-bedroom, don't quote me on this, it's around,
Give a range,
like
right?
it's like 600 square feet for a 1-bedroom, and then a 3-bedroom I think it's almost 1,100 square feet.
Okay.
But they provide all those different types because there are families with people in recovery programs, so they want to be able to provide that. So that they also divide the 2 buildings. There's 2 buildings for the 60 units, and there's more of a family approach building with the larger units, and then a single 1-bedroom units in the other to kind of separate families and let them have their own spot. And that's how it was set up in Jackson, and it's been quite successful so far.
Okay, and then you did state that there are still some other applications in the works, right? Like
Correct.
you're still working, okay.
And then there's those 8 applications. Those are the people that took the time to put in like through our application portal, but then Khadijah and I are out there constantly meeting and talking with people.
I know. Oh, you know they're letting me know. We're not gonna talk about that. I just wanted to ask to verify that a little bit. That's it.
Yeah, we're out there, making sure that we're finding and uncovering all different types of options, because we want to make sure that we're providing and allocating our resources throughout the entire county. Yeah. For so long, a lot of the activity's been in certain areas. So we want to make sure that we're providing a diversity of product types and services and a diversity of geography. So that's why we're out there meeting with anybody that'll listen. So if you know of anybody in your communities that would like to talk.
I just want to say thank you because I've already referred them and you all have been in contact with them, so thank you.
Yeah.
I've said no promises. Like I told them, they got to get through the process just like everybody else. But I do thank you all for being committed and doing exactly what y'all said from day one. And this is very, very enlightening to me for us to be even helping in this space around the county. And I just want to ask our chairman, now chairman, come on now, we got to like press release this, blow this up, and let people know what us commissioners are bringing in this space.
It will be blasted out.
Okay, so
voting
I just want to make sure. That this county understands that this is such projects that we are working to help in this housing space. So thank you all, because y'all been doing a fantastic job. So thank you.
Thank you. Commissioner Joliet?
Thank you. Wonderful presentation. Lot of information and a lot of contributing parties financially. So who owns you talked about if it's sold, it'll come back to us. So who actually owns the Wellsprings, the cottages?
We can get it, this is the nitty-gritty details of how a tax credit development works, but it's actually owned by a limited partnership. And the limited partnership has partners that include the developer that provides all the financial guarantees and operational guarantees. And then it has a limited partner, which is the tax credit equity investor that invests all the funds. And
Usually through a bank, like a financial.
Yeah, like in this case, they're both Sinair, who are one of the most prolific tax credit equity investors and lenders in the state. So that is the limited partnership is structured that way. Sometimes there's other entities that may put into other things, and Southfield Housing Corporation may also be a limited partner in the Wellspring project as well. But that partnership could eventually be sold, and then the ownership of the actual asset and the land could go to another developer. They can't sell that, they can't do a full sale without our approval to make sure that we review and know that who they're selling the property to is a responsible entity that will carry out and continue to provide the affordable housing and services that are required per the regulatory agreements that are recorded on the property. But if they sell it and they recoup their funds, we also recoup our funds as well.
Okay.
But in any event, the funds from the Housing Trust Fund, generally speaking, if they're the SLFRF funds, require that the property maintain affordability for at least 20 years per the Treasury guidelines. So we'll at least have affordable housing for that long, but because these are both tax credit developments, these will maintain affordability and provide services for at least 45 years per the regulatory agreement that's recorded on the property to make sure. And if they don't do that, then they have to pay back their tax credit dollars, and
Okay.
it goes into default, and then the bank will own it, but that doesn't really happen, so.
Okay, all right, thank you.
But we set it up, long story short, we set this up so that at a certain point, these projects don't cash flow.
I think that was my concern and my question.
They
So it's time and
cash
effort.
flow, but we get paid after everybody else gets paid, because the last thing we wanna do is mess with the operations of the project. And the Housing Trust Fund, it's not a tool that you really, it's not like a hedge fund where
Right.
you're trying to make a bunch of money. We're providing the last bit of funds to cause the development of a project. We will eventually recoup the dollars, but it's not gonna be anytime soon, just because of the nature of affordable housing. It's below market rate, and that's why it takes a while to pay it back, so.
And it would just go back into another project.
Yeah, and then at that
Right, so
time,
we're just recycling.
but then again, we have a project that one I mentioned in Rochester, that's for sale. And so we'll be lending those dollars out for only a period of at most 5 years. And then so when the homes are sold, then we get repaid, and then we'll be able to reinvest those into new developments at a quicker clip. So I'm more than happy to discuss that, at a later date when it's
Right,
not on,
gotcha.
a different agenda item, so.
Thank you.
Thank you. Commissioner Erickson Galt.
Thank you,
Didn't say
Madam.
and.
Thank you, Madam Chair. This is directed in particular at the Royal Oak Cottages. Is there any emphasis on making these accessible in terms of, I noticed, and why I was asking that question is the one example is a 2-story. So obviously somebody who had a physical disability might have difficulty.
All of the units can be designed and made accessible. Let me see what the actual,
There was a certain number of units put aside.
there was actually over, because they qualified for extra scoring allocation from the Housing Trust Fund scoring review team. I think it's something over 10%, maybe almost 15% of the units will be made accessible for residents. And I do know that does include having barrier-free entry or main floor access. And I think they might actually have a version of a home, one of the 1,300 square foot model may only be single story. So they're still in the design process, like we approve projects, but they have committed to providing the accessibility. The LIHTC program requires that 5% of the units are accessible, and then 2% of the units are made available for visual and audio impaired residents. But I know that this is at least 10% of the units will be made accessible, and I can get the actual number. I thought I had it in my sheet here, but I don't see it
Thank you.
readily available. But that's actually part of the Housing Trust Fund's application, where we actually have additional scoring consideration for more accessible units, along with green energy efficiency supplies and minority and women-owned business enterprise participation. So we have a lot of different ways for people to make these projects even better.
Great, thanks.
Commissioner Woodward?
Very quick, because of the mix of federal and state dollars in here, are these all prevailing wage projects?
SLF RF fund projects require prevailing wage.
Done. The next question, I had an opportunity to tour Andy's place with a lot of the team here. That Southfield project is going to save lives. People there told us that project in Jackson saved their life, of people who'd been in and out of jail, and creating the stability and the rigid rules that residents have to follow. to get clean and get a job and get reunited with their family and the progression, it's pretty incredible. I'm so excited that we're able to be part of that project. My last question, I keep asking this question broadly, what does it cost for the public investment to make these projects go? And so based on quick math, it's looking at $50,000 to create a unit to be able to fall into the space. Is that on the high end? I would expect to be a little on the high end just because of Oakland County and the cost of construction and real estate and all that type of stuff. Is that the target mark? Are we hoping in time that we bring that into the 30,000? Like, what is the cost per unit?
From our investment?
I can do the math based on this one, but I mean, it's like, what's the sweet spot that we want to be shooting for long term? So if we're going to spend $50 million on more attainable affordable housing, expect that to create X amount of units. Is that at 30,000, 35,000, or is it going to be closer to this $50,000 mark?
It really depends on the project location. Like land costs are a big consideration, and then some of the permanent supportive housing features do cost a little bit more. And then when you have a single family development, scattered site development, it may not be quite as efficient as a multifamily development. So it really depends, and it also kind of depends on, like I said, land costs are a huge issue, so we'll see. I will say that what we're trying to do as best as we can is to leverage and maximize the Housing Trust Fund dollars as best we can. A lot of the 2.5 and the 2.6 million you see here, that is an identified gap. If that wasn't there and our funds weren't supporting it, they wouldn't be able to service the debt service, and nobody would lend on the project. So they do need that, but then it also, by us providing our financial subsidy to the project, it scores better at the state level because it utilizes their tax credits more efficiently. So it's a balancing act between making sure we have a verified gap, but then also making sure that they have a high efficiency of their tax credit usage at the state. So it's extremely important that and this is why when Michelle Holmes, our Housing Trust coordinator, is here as well, when we receive applications, we always make sure that we know what their state deadlines are, because they need our response and our funds and some sort of commitment from us to make sure that they qualify for their tax credit application. So that's another driver of how this all shakes out, and every project's different, but know that you have a great scoring team and a very professional and great board reviewing and analyzing all of these projects, so. That's great.
Well, I just say in conclusion, I mean, you made the point, if we don't address and solve this housing crisis that we are facing as a country over the next 20 years, like this entire economy, the people who do the things is gonna collapse on itself. And when you get to, I mean, in talking about, there's no question that these dollars investments already instantly take on the return on investment in terms of the total construction to make things happen. This gives me a number to be able to say like, okay, plan for $50,000 a unit. To the extent you guys can over time figure out how to bring that down, we can get even more units on deck. But I mean 104 new affordable attainable units being put into the housing stock in this county is in the first round here is a win. So great job.
I take it.
Thank you. Any other questions or comments? I think we all enjoyed the presentation. Thank you. We prompt the vote now on the health and human service recommendations.
You have 5 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Thank you.
Also, I just looked it up, it's 15.6 of the units will be barrier free from the get-go. But all can be made available as needed, so I was on the wrong page.
Thank you. Our next item is from Emergency Management and Homeland Security. It's our Oakland County Hazard Mitigation Plan. I have a motion by Commissioner Joliet, with support from Commissioner Eric Singal and Tom Hardesty. Is here to talk about this.
Good afternoon, Commissioners. Thank you again for the opportunity. As you mentioned, Tom Hardesty, and I have with me Michael Kamenik, a specialist from our office, who is the the lead person from our office on this project. FEMA requires that every county update their hazard mitigation plan every 5 years. Kind of, as you see in the packet, the plan is very long, a lot of requirements, but the short version is identifying those hazards. They require natural, although we also examine man-made, but looking at those hazards, evaluating what the high risks are, and then working with every single community, schools, anyone from the private who's interested in putting together plans for how do we mitigate or try to minimize what the impact of those hazards might be on the county. It's important that we have this because without having an updated plan, not only is Oakland County not eligible, but no community would be eligible for federal disaster funds, both post-disaster and to work on mitigation projects. For example, the Water Resource Commission has projects for backflow preventers around the county. All of these things aren't eligible without having these plans in place, and those types of projects are actually addressed in these plans as well. Some of the significant differences in this plan from 5 years ago, the FEMA required a significant addressing of concerns of climate change. So there's information on what do we think the minimum impact might be or what could the maximum impact might be, as well as equity concerns. And then along with all the different types of hazards. And it's focused on here. So for example, we're not examining concerns over hurricanes. You know, we're winter weather, tornadoes, those type of disasters that we look at.
Thank you. And we do this every 5 years.
Every 5 years for this, yes.
Okay. Commissioner Woodward?
Sure. So is this the plan that captures if there's any gaps in the siren system and all that type of stuff? Or
So we have two different kind of major
have
plans.
you ever got a question about the siren not being heard? Okay.
So
that's why I'm asking.
Tornadoes themselves, this plan would identify, if a community says, yes, we feel we have gaps in our siren, we tell the communities, if you had a blank checkbook, put every project that you might do that could help minimize hazards, including tornadoes and warning, put them in here. And then over the years, we seek grant funding and see what we can get. So putting those projects in here kind of covers it for that. And then if they get them, it doesn't commit them. But early warning is one of those topics.
Excellent.
So, when this plan is approved, does it go to the cities and townships for approval?
So, it's with the state. The state looks at it and FEMA, and then once FEMA brings it back and says, okay, and they have confirmation that our board has approved it, then we have 1 year to get every community in the county to adopt it.
Okay, thank you. Any other questions or comments? All right, will you prompt the vote?
You have 5 yeas, 0 nays.
Motion carries. Thank you. Thanks for spending your time with us. We move to our final public comment of the day. Is there anyone from the public wishing to comment? Seeing none, public comment is closed. There is no other business to come before this committee, so I will adjourn the committee at 12:37. Thank you, everybody.